to have kidney disease or something, because something happened while I was some years ago. I had like a urinary tract infection, and I was going to Google then, so because I was having this back pain. So when I looked at Google, so it was taking me to I was seeing kidney problem. So then I was dying. I was even dying with that. My blood pressure was going up. So it was when I went to the hospital. The doctor now did a test and said I had urinary tract infection, and that I didn't have any kidney problem, because then immediately I was having that back pain, within my lower region. I was using the internet. What's the meaning of this? So I want to know if, as a kind of preventive measure, is there any connection, like one getting a kidney disease because of infection or untreated infection? Thank you.
Dr. Felix, unmute yourself, please.
I think that you just came to confirm the things I was saying earlier. I mentioned earlier that during the courses that one of the medical conditions that causes chronic kidney disease is urinary tract infections that is poorly treated. And I explained that these infections causes inflammation in our kidney. So if you are somebody who have been getting UTIs and you don't pay attention to it because of the pronounced inflammation that they come with in our urinary system, eventually it leads to scarring tissues in your kidney, and this can eventually put you at risk of chronic kidney disease in future. So yes, infections of the kidney are one of the well-established medical conditions that eventually make us or can make somebody get kidney injury and eventually chronic kidney disease subsequently. So the answer to your question is yes. Blood pressure that you mentioned, we talk about it. We said that the kidney controls blood pressure. So anything that tends to affect the kidney, it will make the kidney to start losing its blood pressure controlling ability, and this will let the person start having high blood pressure. We discussed that also. Thank you very much.
Thank you. Okay, thank you, Dr. Felix. Oh, I have another question here. Okay. Someone said, ask, what are the basic symptoms for the kidney, for the chronic kidney to see a doctor? I think that is what you want to ask. I think you mentioned it earlier.
All right. So as I want to say this again. Please, when you have any symptom, please don't think that it is that or it is that, or go to the Google. Google will give you all sort of things combined, cooked together, mashed up, and even make you confused sometimes. Any symptom that you have, even if it's kidney or whatever you are thinking, the best place to go is hospital. Why? Medical conditions can present with similarities. You can have malaria, and malaria will present like typhoid. You can have typhoid and it will present like malaria. You can have a kidney stone and it will present like a urinary tract infection. The best place to get that, we don't have specific symptoms to say that wait until you get this particular symptom. Any symptom that deviates from the normal function of your body, you go to the hospital. That is my answer to the question. Don't wait to look for one. Thank you very much.
Thank you very much, Dr. Felix. Over to you so far for me and Dennis. Okay.
Hello, Dr. Felix. Please, I want to know what are the signs that someone will start having, like him or she will know that he has a kidney problems? Like, what are the signs?
I'll say this again. That is why we want you to be turning on notification for this platform. Realize that the same questions are coming and coming and coming and coming. We mentioned these things. Do it again. We are here because of you. So I'll go over it again. We say that 1, you can have swelling around your eyes. or your face will be swollen, especially in the morning. You can have swollen eyes, periorbital edema, or the part of the face that you lie down with, that part will be swollen. Okay, that is one way. You can have swollen feet. Okay, your foot, okay, both of them, it will be swollen. They will not be paining you, and when you press them, it will sink inside. Bipedal pitting edema, that is also another sign, so take note of that. We also mentioned that you start having blood pressure problems. Your blood pressure will be going up from time to time. It does not mean that anytime you have high blood pressure you are going to get you have a kidney problem, but high blood pressure on its own also makes you get it. So if you are getting high blood pressure, your kidney needs to be checked. All right, that is very important. Then we also talk about anemia of chronic kidney disease. We also said that you are here all the time, you don't have iron deficiency or G6PD defect, but all the time you have anemia and they don't know the cause. Your kidney needs to be checked, because that also can present that way. We also mentioned that you could wake up in the morning and you have white patches, small patches, like as if they sprinkle some powder and they come out of the skin pores, okay, known as uremic frost. That is also another way that it presents, and you need to pay attention to it. Extremely foamy urine. Everybody foams when you produce, when you go and wee, when you go and pass urine. But if you get to a point where anytime you pass urine, it is over foaming, which wasn't the case in the past, you need to start getting worried, because protein and other things are now seeping through your kidney, and it could lead to kidney problem, and that is also one way chronic kidney disease presents. So take note of that. We also talk about what we call it as it progresses. Okay, as the disease progresses, the amount of urine that you produce may reduce. You start producing little or even no urine. Even when you drink enough water, you don't make more urine. That is also another way, and a host of others. We don't want to start repeating everything, so let me leave it here for now. Thank you very much.
Okay, thank you, Felix, Dr. Felix. Please, I want to know, can a swelling tummy, like someone that tummy is swelling up, like has a swelling tummy, is it one of the signs that somebody have a kidney problem or the liver problem? What's the sign of that if someone has swelling tummy?
Thank you so much for asking. We've answered this. What we said is that there are spaces around your abdomen in the intestine. We have a space between the anterior abdominal wall. There is a layer there we call it the peritoneal space. All right. Now, if you have a kidney problem, you are losing protein, so other things. Now, water will start seeping. Your kidney will not be able to balance the water for you. So water will now be finding its way into any free space within your body. And one way it accumulates is the abdomen, okay? The peritoneal space. Now, in the lungs also, okay? We also have fluid accumulating there. All this can happen from the kidney. When you have a liver problem also, you can also have that. All right. And of course, when you have a heart failure, okay, decompensated heart failure, where the heart is no longer compensating, you can also have fluid accumulating in your body. And all these are known medically as ascites, as I mentioned. So yes, it could be from the liver, it could be from the kidney, it could even be from the heart. End stage. Thank you very much.
Thank you, Chukwudi, for your question. Thank you very much, and do have a lovely week. Please click on the bell so that when we are live, you can join us early. Thank you very much. And someone asked, what if you pee too much?
Okay. Now, when you pee too much, I first want to talk about the common things. There are things that can make you pee too much. When you have a UTI, number one, it can make you pee too much because there is inflammation and this is irritating your urinary system. So it can make you pee much. One common dangerous condition that has a close relation to chronic kidney disease that can make you pee unnecessarily, especially at night. You keep drinking water, you keep weeing, you keep peeing, is diabetes. That person needs to get evaluated for diabetes because it's one of the common conditions that causes kidney disease. At the same time, it will also make you pee a lot. So take note of that.
No, sorry, Dr. Felix. Let me ask you: is it when someone drink too much at night, then go to toilet like 5, 6 times, there is no problem?
Mama, I think we are talking about urination. The question is, it's not
Yeah,
about, it's about
like
pee, right?
pee.
Women.
Yeah,
Yes.
yeah,
In,
but if without drinking too much water, and someone is peeing like 5 to 10 times, 5 times, is that too much at night?
now, let me explain. This is what happens. Now, the more water you take, the more urine you form.
Okay.
However, in people who are having insulin resistant or diabetes, what is happening is that the sugar remains in their bloodstream and keep drawing water from the surrounding. So there is always fluid overload. Because of that, the kidney is working 24/7 to remove the excess fluid overload. So diabetic patients classically, they will pee a lot. At the same time, they have increased thirst. They'll be drinking a lot of water. He or she drinks water. The next few minutes, 1 hour, she's feeling thirsty. She goes to drink, and as they are drinking, they are peeing. They are drinking, they are peeing. That is what we are talking about. It is not so normal. If you are like that, please get yourself checked. I drink a lot of water in a day. I don't take less than 3 liters, but I can count the number of times that I wee or I pee in a day. It's best you get evaluated and you don't have diabetes than you have it and it is not picked up. Thank you. Men who have prostate problems also, you can be passing a lot of urine. But today is not about prostate, so I'll leave that there. Thank you very much.
Thank you very much, Dr. Felix. All right, guys, we have just 4 minutes for these questions because we're going to build our community for 20 minutes, then we use 10 minutes to appreciate everyone. So 4 minutes for question. Moderators, over to you guys.
And the next person was Princess. Could you keep it summarize your question so he could answer it like in one shot?
Good evening, everyone. Please, doctor, I want to ask something about kidney because I'm a dialysis patient. I live in Italy. So, and I want to ask, what is the connection between menstruation and dialysis? Because for a while now, I've been stopped from my menstrual flow. I don't normally have menstrual flow, and urine have stopped also. So I want to know the connection between dialysis and the menstrual flow.
Okay. The problem is not the dialysis that is causing the menstrual issues. The problem is the kidney problem. All right. Number one, do you mind sharing your age? You also need to understand that menses is regulated by interplay of hormones. All right. Interplay of hormones. That is why you see bleeding coming out. The older you get, the closer you get to the menopause, there is decline in the hormones that makes you to menstruate, the estrogen especially. So your menses will become abnormal. But people who have chronic kidney disease, all right, as the disease complicates, as it progresses, what is going to happen eventually is that other organs are also compromised. For example, your pituitary gland and other things, right? I don't want to go so much into these things. You may, I may switch you off. But there is an interplay between chronic kidney disease and your other functional organs in your body. When your kidney is not functioning, your heart will not function well. When your heart is not functioning well, it can make your kidney not to function well. And when your kidney is not functioning well, your other endocrine organs also may not function well. So the problem is not necessarily because you are on dialysis. The problem is that you are on end-stage CKD, and this is affecting other organs, and your endocrine system is also beginning to malfunction. That is why your menses is acting up, especially if you are not close to menopause. Then it's a complication of the condition that you find yourself. Thank you very much.
Thank you, Dr. Felix.
Thank you.
All right, you're welcome.
So fine. And Dennis, over to you, please.
Hi. The next person was Retinal. Or Retinal. Do you have a question?
Retinopanams. Do you have any question or anything you want to say?
Okay, thank you for coming and enjoy the rest of your evening. Thank you. Flora Love. Nice name.
Okay, thank you. I actually don't have a question. I just want to add few points to what Dr. Philip just said. I want to beg especially some of us in diaspora that do self-medication, because most of the time there are some medication we take by ourselves that can cause a kidney problem. A lot of it, even just regular Tylenol. Some people just take it as a regular thing they have to take every day, even when they're not really feeling anything. Maybe they're just a little bit tired or they're stressed. Then the next thing is to take Tylenol, ibuprofen. All these things cause a kidney problem. Please, let's be careful of that, like doing self-medication, taking antibiotics. There are some antibiotics that is very, very dangerous to our kidney. So we have to be very, very careful about that. That's my contribution.
Wow. Thank you,
Thank
Flora.
you very much. Thank you.
Okay, our time is well spent. And then I think we have just one more person in the box. So let's that person ask the question, then we can build our community. Then we can bring that guy up, the one that told us that he was here to build our community for us. So thank you very much, everyone. We appreciate you for joining Tabitha Prosite today.